Hello, PDHP parents and community. Today we're talking about warning signs and symptoms, both physical and behavioral, that can designate to parents and adults in a child's life if they are using substances, like drugs and alcohol, some of the substances that we have looked at over the course of the past few weeks. It's important to note that any of the following signs and symptoms that we discuss can be very normal when it comes to adolescence. But keep in mind that the key is really change, significant change. It's important to notice these significant changes in your child's physical appearance, in their personality, and their attitude or behavior. So some of the physical signs someone may notice if their child is misusing a substance would be perhaps an increase or a loss of appetite, inexplicable weight gain or weight loss, difficulty sleeping, inability to even sleep, or perhaps unusual fatigue or laziness. The smell of substance on one's breath or their clothing, nausea, vomiting, sweating, shaking of hands and feet and head, frequent nasal or sinus infections, red watery eyes, pupils that are either larger or smaller than usual, blank stare, a thick tongue, slurred speech. Behavioral signs would include changes in attitude or personality. Remember, significant changes. Perhaps a change in friends, a change in new places to hang out, new activities, new hobbies, new sports, or maybe a lack of. A drop in grades or work performance, isolation, secretive behaviors, moodiness, irritability, nervousness, giddiness, nodding off, wearing long sleeve shirts or layers of clothing out of season, stealing, you may notice items or cash missing, household items missing like money, alcohol. Very important if you have alcohol at home to secure it, just like we talked about prescription drugs and over-the-counter drugs. Spoons missing, finding burnt spoons, bottle caps, missing belts and shoelaces, small bags with powder residue, syringe. Within your child's personal items, maybe even checking book bags and things like that. It may include things like eye drops, breath mints, mint tins, or other small containers. There's interest in this interest starts to occur, perhaps another change in apparel that promotes drug and alcohol use. Things like red cups are used as decor or perhaps as a way to store items in one's room. So we see an increased interest in culture, drug, alcohol, substance culture. So things to consider, significant change. Have a great day, PDHP parents. Tomorrow we'll talk about some actions that we can take to be preventive parents.